Hello, my name is Dr. Gabriel Corral. Today we will be watching a breast augmentation preparation video. This video is intended to help patients guide them through the preoperative process of surgery, as well as managing expectations and what to expect during the postoperative recovery. I hope that you enjoy. Thank you for watching. First, a few facts about breast augmentation. Some insurance carriers cover the procedure under the diagnosis of gender dysphoria. Many insurance carriers do not cover any future procedures, revisions, or complications related to the index procedure for the breast augmentation. Another important fact is for patients is for them to know that by placing an implant in your body, you have more than 30% chance of needing another surgery at some point in your life. If you want to avoid this, the best thing to do is not to have the breast augmentation. Recovery time after breast augmentation is generally between 2 and 3 weeks. 6 weeks is usually the time where you can initiate any physical activity that is related to a gym, swimming, or heavy lifting more than 10 pounds. Every surgeon does this differently, so make sure that you contact your surgeon about the specifics. Most patients do not take any pain medication after 10 days. It is usually an outpatient procedure, and the overall complication rate after a breast augmentation is low, less than 10%. A few tips before your consultation. Make sure that you bring a picture of your desired aesthetic goal. This will help communicate with your plastic surgeon to determine what's going to be realistic during your consultation and after surgery. Make sure that you bring a brassiere during your consultation without padding, without underwire, as the surgeon may ask you to try different sizes during the consultation to determine what implant fits your body best. Be prepared to take photographs. No need to wear a lot of jewelry, and make sure your hair is up to make sure that it's off away from the pictures. Be honest about any smoking or vaping history. This is important. Make sure that if you are a smoker, discuss this with your plastic surgeon so they can really assess and address the need for stopping any type of nicotine products prior to a breast augmentation, as this can impact your healing and increase your complication risk. During your consultation, you'll discuss a full medical history with us. We'll also use multiple implant sizers to find what best fits your body type. As we discussed, you can bring a brassiere or other clothing like a bikini if you want to see how the implant sizers may look using different types of clothing. You'll be probably asked to sign an FDA consent, as the FDA is now requiring every patient who's having a breast implant to sign an FDA consent discussing and initialing all the potential risks for this specific procedure. And then there'll be probably more photographs that will be taken. Some surgeons use three-dimensional systems in order to assess and consult patients during the procedure. How do we determine the best implant to use? Well, there are multiple factors that we take into consideration when looking at a patient. We look at the current breast shape. It's not uncommon after hormone replacement therapy that patients have different levels of growth in the breast tissue, and sometimes this growth is not symmetric. Sometimes the implants have to be different volumes in order to make sure that they look as best or as close as possible. We also will do some measurements of the chest dimension, including the width of the breast. It's called the base diameter. We look at the volume of the skin, the volume and the skin elasticity. And then we look at the difference between a teardrop and a round implant. If patients have very minimal growth during using HRT, and the nipple to inframammary fold distance is very short, then patients may require a tissue expander, which is a staged procedure in which the patient will have an expander first in order to increase the volume of the skin, followed by placement of an implant. Breast augmentation is also not a replacement for a breast lift. This is very important. If the nipples are pointing down, or you fail the pencil test as shown in this picture, where if you can hold a pencil with your breast, most likely you're going to need a breast lift. If that is the case, you may need to have a breast lift at the same time or initially before a breast augmentation. Most insurance carriers don't cover breast lift for this specific diagnosis. So there are many options in the market for saline and silicone implants. I want to share with you differences between saline and silicone. A saline implant has been around for a long time. The way it works, it has a seal valve on the back of the implant that once it's placed, the implant can be filled with saline. It's an adjustable volume or a range that we can use in order to improve that volume. It's usually allowed for a smaller incision, as you can roll the implant like a taco and place it in the pocket. It's usually a little bit more firm, and it also allows for more wrinkling or rippling for a saline implant. There's also water-herm interaction. Sometimes you can hear the saline in the implant if you're doing some intense physical exercise. There is a possibility of deflation over time because the valve can tend to leak over time, and you may lose a little bit of the saline volume. And if you lose the saline, it can increase the rippling as the volume of the implant is deflating. They've been approved since the 2000s, and it's usually the procedure of choice if you are between older than 18 years old. Silicone gel implants are usually have changed over the last several years. We're in the 5th generation of silicone implants. These are pre-filled silicone implants by the manufacturer. It's usually one specific size. Usually the incision can be a little bit larger, but not by much, maybe about 1 centimeter. Usually our incisions are about 4 centimeters in length. They're usually very soft. They're natural. It's a cohesive gel, so it allows you for a more natural. There's no sound. There's less wrinkles and ripples, and it can be placed in any pocket, either above or below the muscle. There's a possibility of silent rupture, and that means that the implant shell has ruptured, and the only way to detect that is with an MRI. Our current guidelines, if you have a silicone implant, there's no need to replace it every 10 years, but you should have an MRI every 3 to 5 years to make sure that a silent rupture has not occurred. They've been approved since 2006, and it's usually only indicated if patients are greater than 22 years old. What about the pocket? Do we place the implant above or below the muscle? That is a very common question, and there are a couple of facts that I want to share with all of you. If we decided to place an implant in the submuscular pocket, which means that the implant will be underneath the pectoralis major muscle, it is usually not placed completely underneath the muscle. It's usually, as you've shown in this picture, the muscle is released inferiorly, and you can see how the muscle is covering the majority of the superior pole of the implant, but inferiorly it's covered by breast implant. This is called a dual plane, but it's very similar to a submuscular pocket. It allows for a smooth upper pole transition because you have that muscle covering that implant superiorly. So in thinner patients, it's a good option because the muscle will minimize any rippling. There's also less risk of capsular contracture, which is when scar tissue forms around the implant. Because we're addressing and cutting the muscle, there's going to be more initial post-op pain. And there's more animation deformity, which means when the patient tries to move that muscle by lifting an object or pulling, that muscle is going to jump and it's going to interact with that implant. It's going to move that implant superiorly and inferiorly again. That is called animation deformity. What about when we're talking about underneath the glandular tissue or within the glandular tissue? That is called a subglandular pocket. That means that the muscle stays down and the implant is placed above the muscle directly underneath the breast tissue. If the implant is more superficial, it's going to cause potentially more rippling and more visibility. There's also data showing that the risk of capsular contracture is slightly higher because there is manipulation of the breast ducts that can have some bacteria, and that bacteria can create not only possibility of infection, but also increase in capsular contracture. There's also less pain because we're not damaging the muscle, and there's no animation deformity, but also allows for placement of a larger implant as you're not constricted by the muscle pocket. You have a much wider space where you can place an implant and the skin can stretch. So those are the two main differences between a dual plane submuscular implant and a subglandular implant placement. Let's talk about complications. There are immediate complications and there are late complications. These are the numerous potential immediate adverse complications that can happen. Patients can develop a hematoma, which is a formation of blood in the pocket, accumulation of fluid, also known as a seroma, wound dehiscence, a surgical site infection, a implant infection, which is called periprosthetic infection. They could be visible wrinkles, which is called rippling. You can sometimes feel the implant folds because there's an implant underneath the skin. There could be slightly asymmetry of the implant, or it could be a displacement of the implant because the implant may have moved to one side or the other. That is called malposition. Over time, implants carry a certain weight and they can cause the breast to be slightly more droopy. That is called ptosis, and they could be swelling. If we looked at long-term effects, There are many of those, but most of it are related to scar formation, either the scar externally, such as a keloid or hypertrophic scar, or a capsular contracture. There's also the possibility of implant rupture, although this implant rupture rate is low. These are not lifetime devices. It could last you forever, but it's important to have the proper radiologic surveillance, as we discussed before, every 3 to 5 years to ensure that implant is okay. Let's discuss a few complications and how do we address them. Breast augmentation malposition is something that it can occur. It's actually very unusual, but that means when the implant may have moved from the initial location. There's different risk factors for this to happen, but in patients who are thinner, who have a lower BMI, their soft tissues are weaker, and that allows for the implant sometimes to migrate to one side or the other. That's sometimes related to early physical activity or any trauma, or simply over time, as shown in this patient's picture, that implant has slowly migrated inferiorly. Sometimes it's related to the surgery. If the surgeon dissected or over dissected slightly, that implant can go into that space that was created. So it's important to make sure that you're taking it easy, using the right support after surgery to prevent the implant malposition. The larger the implant, as you can imagine, the more likely they can migrate medially or laterally. There's also some patients who desire to undergo for a subpectoral or below the muscle implant placement. And every time that muscle activates, it's pushing that implant laterally. And that can certainly happen and create an area of malposition. What about rupture? There are two kinds of implant rupture, intracapsular or extracapsular. If you can look at the picture on the left-hand side shows an intracapsular rupture. That means that the implant external shell is okay, but within the implant itself, there is a rupture of the inner capsule that there exists. The extracapsular is when there is a rupture of the external shell of the implant, and there could be a small degree of silicone outside that implant that is within that capsule of the breast tissue. Usually we see this happen with older implants, as the first generation of implants have different types of shells that are more susceptible for rupture. There's a possibility that subglandular implants can rupture easier because they are more exposed to potential trauma. Capsular contracture is something that we see as an effect of a rupture. Some patients don't know that they have a rupture, but they come back with a capsular contracture. And that capsular contracture is an inflammatory response of the body against the rupture that has occurred. So most likely your surgeon may send you for an MRI if this happens to ensure that the implant is okay. Any trauma or any local problems can cause implant rupture. And there is no evidence that shows that a round versus a teardrop implant has a higher degree of rupture. Same thing with saline versus silicone. Those are very similar in studies when it talks to rupture rates. Some of the late complications that we see primarily is the capsular contracture. So some of those effects could be a late infection, a capsular contracture, a silicone granuloma, ALCL lymphoma, and breast implant illness. In the picture on the left side, there's a patient with a severe capsular contracture. There's been a capsule that has formed around the implants as an inflammatory response, and those implants have migrated superiorly. You can see on the MRI, this patient's capsules, the implants are not in normal shape. They're almost very vertical. On the implant on the left side, there is some lines. We call that the Linguini sign, and that means that the implant is ruptured. And that is one of the ways that we identify these findings on the MRI. So what can you do to avoid capsular contracture? A few tips that I can give you is that you want to avoid medications and supplements for 2 weeks before surgery. Any type of herbal supplements should be discontinued. Any type of nicotine should be discontinued 6 weeks prior to surgery. Avoid oral surgery for 3 months prior to your breast augmentation, because this prevents any bacteria from spreading from the dental procedure into your circulation. Avoid and quit smoking. Request sometimes that the implants are placed in the dual plane or subpectoral, as this has shown to decrease capsular contracture. Take an antibiotic, as your surgeon most likely will send you an antibiotic for a short period of time. In the past, there's been some thoughts about massaging the breast in order to minimize capsular contracture. This is something that we used to do in the past, but there's really not good data that shows that massaging will prevent from capsular contracture. There are some other data that shows a few tips that we can do during surgery in order to avoid capsular contracture. If we look into the procedure itself, there is a very important fact in which we know that any bacteria or any blood present in the pocket can contribute to capsular contracture formation. So in order for us to have minimize this risk, we ensure that we have impeccable surgical technique to make sure that everything is extremely dry with multiple and copious amounts of antibiotic irrigation and betadine. We also use a what is called a kennel funnel. See if I can show this video. Where a funnel is shown to place the implant. So what we generally do is we would place the implant in this plastic funnel, and without touching the implant is placed in the body. This no-touch technique, where the implant hasn't been touched by the surgeon or the patient's skin, has been shown to improve and decrease the chance of capsular contracture. What about ALCL? ALCL is a rare form of lymphoma that is extremely rare and is followed by silicone implants placed, most commonly seen by texture implants. Currently at our institution, we do not offer any further texture implants. All we use are smooth, round implants in order to minimize the chances of having anyone forming ALCL lymphoma. Although it is a rare condition, it needs to be taken care very carefully. The main symptom of ALCL is when the patient develops a mass or swelling after a breast implant. It usually happens many years after the original operation, where the implant has been in place for many years and the patient forms a large fluid collection or a mass. Usually, as we discussed before, texture implants have a higher risk. This could be round texture implants or anatomical texture implants. The type of implant, meaning cellular and silicone, does not appear to affect the risk for ALCL. If this happens, the surgeon will go and will identify the fluid. The fluid will have to be sent for cytology, and there's a specific marker called CD30 that we test. And the usual treatment is to remove the entire implant and the capsule from that body in order to be tested, and the discussion of having another implant can be taking place at that point. What about breast implant illness? Breast implant illness is something that we have seen in recent years. It's something that we see that patients can develop after any type of breast augmentation, either with saline or silicone, regardless of where pocket are they placed, either above or below the muscle. Currently, there are no good tests to diagnose this, so it's a diagnosis of exclusion. These are all the symptoms that could be caused by breast implant illness. Anything from rashes to memory loss, from weakness, depression, anxiety, vertigo, and there's a whole list of systemic symptoms where the patient may develop. There have been several studies that have shown that although we have no specific tests to identify this condition, usually if we can remove the implants, patients tend to get better, usually within the first 1 to 3 months after surgery. It is a rare condition, but it's important for all folks to know that this is a possibility, especially for individuals who have been diagnosed with rheumatologic diseases and are perhaps taking any type of immunosuppressants. That's something to consider and have that discussion prior to a breast augmentation. Post-op care, we review a few guidelines. It's important for everyone to know that they need to be taking time off. Usually we recommend 3 weeks. Ability to return to the gym or intense physical activity is about 6 weeks. We recommend for everyone to wear support for about 6 weeks. You want to avoid any bathing or swimming or any immersion in water until your incisions are completely healed. Try to avoid also any underwire brassiere. You may shower after 24 hours depending on the type of dressing, but for our practice, we recommend showering after 24 hours. And usually recommend starting silicone treatment with any type of silicone strip, or such as Embrace or biocorneum, and that process should take at least 12 months of treatment. Remember, after surgery, your implants will tend to have a tendency to be much higher with a very flat lower pole. It really takes 6 months to 12 months for that implant to slowly drop and the skin to actually expand. So be patient about this process. Post-op care, recovery time takes approximately 3 weeks. Return to the gym or physical activity at 6 weeks. You want to continue wearing your support brassiere for 6 weeks, a day and night. Avoid any immersion of water, such as bathing and swimming. Avoid any underwire brassieres, and you may shower after 24 hours. Scar treatment is recommended with silicone strips or biocorneum for at least 12 months after your surgery. Remember, be patient. The implant at first is going to look very full at the top and flat at the bottom. That symmetry will change over time as the implant will have a tendency to open the lower pole and expand that, making it look natural, make it look softer. So that process takes time. This is a picture of a brassiere that we recommend. It's you can buy it anywhere. This is a picture from Amazon for $35, but you want to have something that clips or zips in the front will be easier than just a regular sport brassiere. What about the, this is a picture of, you can see, of a breast augmentation. This is before surgery. This is 3 weeks out with the majority of the fullness superiorly. And you can see how that fullness has now decreased and the lower pole of the breast has expanded at 3 months. This process will continue, as we said, for about 12 months. So just be patient with your reconstruction. Thank you for watching. If you have any questions, please email us at gender.affirmation@medstar.net. Bye-bye.